Hello friends, welcome back to our YouTube channel Doctorscorner. Today we are going to discuss about carotid triangle. Carotid triangle can be a 3 marks question in the subject anatomy of first year MBBS. Also, this is very important clinically. So first we will discuss briefly about the boundaries of this carotid triangle, then we will discuss about the contents of the carotid triangle, also the structures forming the roofs and the floor. Okay, so first let us discuss the boundaries of the carotid triangle. So basically this carotid triangle is one of the part of the anterior triangle of the neck. So anterosuperiorly it is formed by posterior belly of the digastric muscle and the stylohyoid. Posterior belly of the digastric muscle, and the stylohyoid muscle. Okay, so let me show you in this boundary in the diagram of a neck. So this is the anterosuperior border. Okay, so with the blue color I am highlighting this muscle, that is the posterior belly of the digastric muscle, which forms the anterosuperior boundary of the carotid triangle. Okay, also there is some part of the stylohyoid muscle also. Okay, now coming to the antero-inferior boundary of this carotid triangle. Antero-inferiorly it is formed by superior belly of the omohyoid. Superior belly of the omohyoid muscle. Okay, so this superior belly of the omohyoid muscle which forms the antero-inferior boundary, I am just highlighting with this blue color now. So this is the omohyoid muscle superior belly. Okay, now the posterior border, that is posteriorly it is formed by the anterior border of the sternocleidomastoid muscle. Anterior border of the sternocleidomastoid muscle. Okay, hope the boundaries are clear to you. Okay, once again I will highlight this boundaries in this diagram. So this is the posterior boundary which I am highlighting with this blue color right now. So you can see this one, this big muscle is the sternocleidomastoid muscle. So it forms the posterior boundary, that is the anterior border of the sternocleidomastoid muscle. Okay, so in this boundaries there is a triangle, that is the carotid triangle, which is one of the part of the anterior triangle of the neck, and it is also called as carotid triangle because the content of this, it consists of the carotid arteries, common carotid artery, external carotid artery and internal carotid artery, which we will discuss in the contents. Okay, hope the boundaries are very much clear to everyone. Now let us see the structures forming the roof of this triangle. Okay, the structures forming the roof of this triangle. So from outer layer, so basically it is made up of skin, then superficial fascia. So superficial fascia which contains the platysma muscle. Okay, platysma muscle. So basically this platysma muscle is a subcutaneous muscle. Okay, it is a subcutaneous muscle. Platysma muscle is a subcutaneous muscle. Also in the superficial fascia we can see the cervical branch of the facial nerve. You can see the cervical branch of the facial nerve, then there is also transverse cutaneous nerve of the neck, transverse cutaneous nerve of the neck. Okay, then of course there is deep cervical fascia investing layer. Okay, so the third content which forms the roof is investing layer of the deep cervical fascia. Investing layer of deep cervical fascia. Okay, so these are the structures which forms the roof. Okay, now let us discuss the structures which forms the floor, of the muscle. Floor of the carotid triangle. Okay, so basically they are formed by the muscles. So which muscles they form the floor are? Basically they are the middle constrictor of the pharynx. Middle constrictor. So in the floor we can see the middle constrictor of the pharynx, this muscle. Also we can see the inferior constrictor of the pharynx, the inferior constrictor of pharynx. Then even the thyrohyoid membrane is visible, thyrohyoid membrane. So these are the structures which form the floor of the carotid triangle. Now the most important part which can be asked in the viva or a short question is describe the contents or just enumerate the contents of the carotid triangle. Okay, so we will discuss this carotid triangle contents under the headings like arteries, veins, nerves and lymph nodes. Okay, so let us first discuss what are the arteries which are present in the carotid triangle. Okay, so the arteries which are present in the carotid triangle are, the most important one is the common carotid artery. Okay, common carotid artery. So because of this presence of the common carotid artery and its bifurcating branches like into internal and external carotid artery, this triangle is also known as carotid triangle. So this common carotid artery also has the carotid sinus, which has a clinical importance because this carotid sinus has a baroreceptors which will control the blood pressure. Okay, so carotid sinus and even the carotid bodies. Okay, carotid sinus and the carotid bodies at its termination, then it will terminate into internal and external carotid artery. So another content is internal carotid artery. So all the carotid arteries you can see in this carotid triangle. Also we can see the external carotid artery. So it is also the site for the palpation, for the pulsation of the carotid pulse. Okay, so the external carotid artery. So usually for carotid pulse we feel the common carotid artery against the transverse process of the cervical vertebra. So external carotid artery has many branches. Few of the branches of the external carotid artery is visible in this. So let us see the branches of the external carotid artery which are seen in the carotid triangle. Superior thyroid artery, then lingual artery, even the facial artery, then ascending pharyngeal and finally even the occipital artery. Okay, occipital branches. So these branches of the external carotid arteries are also present in the carotid triangle. So let us just see the diagrammatic view of this content of, that is the arteries. So you can see this one is the external carotid artery, carotid sinus, okay, even the internal carotid artery. So further you can see the branches of this external carotid artery like lingual artery, okay, cervical portion of the facial artery. So these are the arteries which are present in the carotid triangle. Now let us discuss the veins which are present in the carotid triangle. So here important veins of the neck like internal jugular vein, okay, the most important vein which is present here is internal jugular vein. Also the other veins which drains into the internal jugular vein like common facial vein which will drain into internal jugular vein. Similarly a pharyngeal vein which also drain into the internal jugular vein, and finally even the lingual vein which usually terminates in the internal jugular vein. Okay, so these are the contents of the carotid triangle. So let us see the diagrams of this. So you can see the most important content is this internal jugular vein along with the lingual vein and the facial vein. Okay. So now let us see the nerves which are present in this carotid triangle. So nerves which are present in this carotid triangle. So the most important nerve you can see in this carotid triangle is the vagus nerve, which runs vertically downwards. So the vagus nerve, also the superior laryngeal branch of the vagus nerve, then superior laryngeal branch of the vagus nerve. Okay, usually it will divides into it is dividing into the internal and external laryngeal nerves. Okay, and the spinal accessory nerve running backwards over the internal jugular vein. So spinal accessory nerve. Okay, and finally even the hypoglossal nerve which is running forwards over the external and internal carotid arteries. So this hypoglossal nerve gives off the upper root of the ansa cervicalis. Again, important term, ansa cervicalis, we will discuss in some other video what is ansa cervicalis and all, timing remember. So this is also present there. Then finally the sympathetic chain which also runs vertically downward, sympathetic chain, and posterior to the carotid sheath, and important one is carotid sheath and its contents. Carotid sheath with its contents are also present with its contents. Okay, so let us see the diagrammatic representation of this contents of the nerves. Okay, so here the most important one is the vagus nerve. Okay, and the superior laryngeal branch of the vagus nerve and other nerves. Okay, and apart from these arteries, veins and nerves, even the lymph nodes are also seen. Okay, so let us see which lymph nodes are present in this carotid triangle. So the most important one is the deep cervical lymph nodes, which are situated along the internal jugular vein, and it also include the jugulo-digastric node, which is below the posterior belly of the digastric muscle, and also the jugulo-omohyoid node. Okay, jugulo-omohyoid node above the inferior belly of the omohyoid. Okay, so this is all about the carotid triangle. So let us revise what we have studied today. We have discussed the boundaries of the carotid triangle, then we have seen the structures forming the roof of the carotid triangle, then the structures forming the floor, and the most important one is the contents. In that contents we have discussed about the arteries, veins, nerves and the lymph nodes. Okay, hope you liked our video. If you liked our video, please subscribe our channel and share the link